Thank you everybody for joining us for this week's medical sales live stream. We got a really important, very interesting topic today. This is a new program I was completely unaware of. Today we have on Johnny Ross. Johnny is the CEO and founder of MedHab. MedHab makes some very interesting solutions, especially in the physical medicine space. So if you guys have contacts with orthopedists or physical therapists, anything in the physical medicine space, you're going to want to listen up because this is a new program, a new patient benefit, and something that can really enhance patient outcomes and replace some pretty significant revenue that these, especially the physical therapists, are missing out on right now. So without any further ado, Johnny, take it away.
Great. Thank you for that introduction, Michael. Everybody, hi, my name is Johnny Ross, CEO of MedHab. We manufacture and develop wearable technology. That's what we do. And many of you have already heard of remote patient monitoring, where you can measure certain physiological measurements for patients, and those patients can be monitored over the long term remotely. And that's really been a play that's really benefited a lot of your family practitioners, but not so much physical therapy and not so much orthopedics. That game has now changed, however. Recently, in January, matter of fact, Medicare had a new ruling with a program called Remote Therapeutic Monitoring, or RTM. It operates very similarly to how RPM does, whereby a doctor's NPI, everything is run through that NPI, and he or she can have a clinical designate, like a medical assistant, taking care of that patient's long-term needs, allows them to keep doing what they need to do important to the practice. Well, the same thing is applicable to RTM, whereby this time it's billed under the physical therapist's NPI. However, all the monitoring can be done by a physical therapy assistant. So in the clinic, when things are going on and busy with patients that really need all the additional help, the therapist can continue to do that while having all these patients through RTM monitored for the long term, which is really important. And when I say long term, it really starts in the acute setting, where preoperative therapy is available now with monitoring devices. We have two of them, StepRite and MyNotifier X, that can monitor and understand a patient's compliance, their ability, and get them ready for surgery. But with Medicare's standard of care of 16 days of therapy and getting paid for that either in-house or remotely. Post-surgically, there's 24 days of therapy. This is not new to the therapists on this part. They'll do what they do post-surgically all the time, right? But once they're done with that post-surgical therapy, then it moves into RTM, and this can be monitored for the long haul, where the provider, in this case, the physical therapist, is earning revenue on a per patient per month basis for as long as that patient is using the device. Now, if the orthopedic surgeon owns his or her own physical therapist, their therapist can do this with the software that we can license, or if they don't own their own physical therapist, we can have a turnkey solution where our team of PTs across the country will take care of those patients for them. And the beauty about this program, and why we have the title slide here, RTM and RPM, is because Medicare right now will not disqualify reimbursements for a provider doing both. So for example, if the patient presents with the right knee, let's say that's going to need surgery, maybe a total knee, well, that's where the RTM is taking effect, and that's what's monitored. However, most patients that walk into that orthopedic surgeon's room or that physical therapy clinic, they have multiple joints. Maybe it's the other knee, maybe it's the low back, maybe it's a hip that's also arthritic. There, in that case, RPM can be performed on that off joint, if you will, and therefore the doctor, the PT, and the patient all have what they need in that continuation of care. So it's all about enhancing revenue by virtue of giving patients, the exact devices that they need. And in this case here, I'll talk about the devices momentarily, but those three modalities of revenue are remote therapeutic monitoring, remote patient monitoring, and CCM or PCM. The difference is CCM is chronic care management, and that's the different assessments that are necessary and mandated, I might add, by Medicare. This is normally reserved for a family practitioner or non-specialist. However, when you're dealing with that physical therapist and you're dealing with that orthopedic surgeon, neurologist, or even rheumatologist, as a specialist, now you're talking about PCM, which is principal care management. That is an add-on to RTM or RPM services that can add another $70 to $80 to that doctor's pocket per month. There's certain codes that will go over that actually demonstrate that, so you can have a better understanding of it. So the revenue opportunity is really significant when we start talking about RTM, RPM, and so forth and so on. And I turn your eyes to this first bullet here because I mentioned earlier about pre-surgical therapy, and Medicare's standard of care is 16 visits, and they reimburse $100.44 with an expected 20% copay. And I put this up top because what's important to understand is pretty much all surgeons at this point in time want to do pre-therapeutic or pre-surgical therapy. And they just don't have the opportunity because patients aren't motivated to go into the clinic to see you or see a physical therapist, right? And therapists would love this opportunity as well. So what's different now? Well, the fact that there's a monitoring device, either StepRite or my Notify RX that I have, I haven't read this in a while, so I'm screwing up and I'm getting a little irritated because this is a busy day.
That's
Sorry.
okay. Just go over more broad strokes. Don't even worry about it. I'll splice this together. It will look fine.
Okay, ready? Okay, I'd like to turn your eyes here on this revenue slide here. In the first bullet, I mentioned earlier that there's 16 days of therapy, which is a standard of care pre-surgical therapy. Medicare pays $144 on that. I should say actually 80% of that because there's a $20 copay. But patients right now are not doing a very good job with pre-surgical therapy. Providers like your orthopedic surgeons and physical therapists would like to do that, but there's no mechanism in place to monitor it. Now you can with our devices, which opens the door to this revenue stream for that physical therapist or that orthopedist. But more importantly, it gets that patient ready for surgery for a better outcome. It's a big problem that they face right now. So as you move past the 16 days of therapy, the same thing that they normally do post-surgically, there's going to be 24 days of therapy that they get through Medicare reimbursements. Again, that's at about $100.44 per session. But then once that's done, now all of a sudden RTM comes into play. And most surgeons, most physical therapists, they want their patients to continue therapy for the long term, because if they don't, that joint that was repaired it's just not going to do as well as it would. But what happens today is once they're done with their 24 days of therapy, which might be stretched out over a 3-month period, the physical therapist says, here, do these, a sheet of paper, do these exercises and keep doing them. What happens? The patient doesn't do it, and that's the end of it. Now, with RTM, that patient's going to be able to do some very easy exercises in the comfort of their home while they're monitored by that physical therapist. And I'm talking exercises like simple walking. Our devices do gait analysis. It could be sit to stand, which is very difficult for these senior patients. Heel to toe walking, hip abductions, whatever that patient and that therapist decide that they want to do on a daily basis is what the patient does, however minimum it might be. And then on top of that, now this is RTM. A third modality that we were talking about is RPM. Now, RPM does not benefit the physical therapist. It benefits the orthopedic surgeon. So while RTM may be performed on the arthritic joint that requires surgery, RPM can be performed on another joint that's arthritic that may or may not require surgery in the future. So in this case now, the doctor's making RPM and PCM money. The physical therapist is making RTM money, and the patient has a device that they get to use for the long term. So the codes are pretty simple. I'm just going to go over a few of them here. But for that 16 days of therapy, that's pre-surgical, or even the 24 days post-surgical, these are the codes. And these are simple codes that a physical therapist uses every day. 97110, 97112, and 97530. This gives them the time allotted, which is 55 minutes for that pre-surgical encounter. Now, that encounter could be them on the phone, just like we are today, and communicating with each other. It could be time that's spent analyzing data, talking to the doctor, talking to the patient. Any time assessed is applicable to this code. The beauty about this, before remote patient monitoring or before remote therapeutic monitor, might say before COVID, all this had to be done in the clinic. Now the physical therapist can do this in clinic or remotely using the exact same codes that they're used to. So when it comes to RPM, these are the codes in RTM. So the RPM codes are slightly different. They're 99 series codes. You'll see here, these are 98. These are specific here to the physical therapist. Doesn't look like a whole lot of money, but think about this. It's not the physical therapist doing the work. It is a clinical designate of his or hers, likely a physical therapy assistant. So that person now is engaged with potentially 50 or 100 patients at any given time, generating this revenue on a per patient per month basis. I won't go over too many of the codes here, but there's a simple one here on the education that pays, anywhere from, say $17 to $25. It's geographically coded and reimbursed. To the codes here that are the driving codes, that right here, 80 and 81, that are paying, this remote session, that's $100 per month almost right there, just taking care of that patient for 20-minute time periods. Each of these is a block of 20 minutes. Again, doesn't mean 20 minutes in front of the patient. It could be talking to the patient, talking to the doctor, emailing the patient, emailing the doctor, analyzing the data. Anything associated with that patient is applicable. And we have the possibility of doing a turnkey solution if there's a PT that's needed, or we will train the PTs that and they can do this for the providers and for themselves. And we even have software that walks them through every bit of how to document this so that they're covered for the appropriate reimbursements, as well as in the case of an audit. Our devices are StepRite and MyNotify. Today, I'm not going to, for brevity here, not going to click on the links, but the StepRite is the workhorse device. Anytime a patient would have a lumbar injury or a lower extremity, hip, knee, or ankle that impedes their ambulation, their strength, and their range of motion, StepRite is what would be used. It's just a pair of insoles. Think of like Dr. Scholl's insoles. However, all the technology is resonant within the insole to include force sensors, accelerometers, and a microprocessor. This device does gait analysis. No more going to a gait lab. Now, to a hospital or a clinic. Now that patient can do gait right there in their house. In fact, they could walk up and down their living room, up and down a hallway, and we do the gait, and all this data is transmitted directly to our HIPAA secured server, where that physical therapist or that orthopedic surgeon is able to see that information. And I'll show you some charts here momentarily what this looks like, or a dashboard. But in addition to gait analysis, and in fact, we have the patent on remote gait analysis, I might add, the StepRite device also does force distribution. So what it's looking for is how a person stands. Are they symmetrical, or is one leg doing more work than the other? Are within that foot, there's quadrants of sensing. Are they behind the ankle, on the ball of foot? Are they supinated? Are they pronated? All that has to do with mobility and balance and pain, matter of fact. And then in addition to that, StepRite does range of motion. And we have, to measure all this, we have over 170 American Physical Therapy Association approved exercises from which a provider can choose to get the best regimen for that patient for the best possible outcome. And it can be amended to the nth degree to meet that patient's needs. But range of motion to the degree. For example, if you're doing a knee extension, with the algorithms, it knows exactly when the knee's up, when the knee's down, the degrees of motion, and it actually measures the impacted leg or the surgically repaired leg, let's say, to the non-surgically repaired leg. And then it also shows what a good joint looks like. So how far off is that patient on both? The patient actually gets to see that. It's kind of fun. So they see where they are, helps them work a little harder. But the detail is in the reports is what allows that physical therapist to look at compliance, the exact range of motion over time or with each repetition, and if they're doing it correctly, and then they can change it. The other device right here is called MyNotify RX, and it's actually two devices in one. First of all, it's a therapeutic device, and it's reserved for anything in the cervical, thoracic spine, or in the shoulders. So much of balance and falling and is what your upper body does, not just your lower body. So if you have that patient that has a surgery on the shoulder, this would be the device they go to, because it's looking at different exercises like scaptions and abductions and so forth and so on, that a patient might need to recover from that upper extremity or cervical or thoracic surgery. And it works the exact same way. And what I mean by that is it's so easy for the patient to use, because all they do is they look at their app is talking to them, and it tells them what to do. While they're doing it, there's a 3D animated image that is mimicking the exercise. So if it's a sit to stand, for example, they can hear it. It audibilizes, and the animated image goes to a seated position, and then it tells them when to stand. If it's a knee abduction or extension, when to raise the knee, when to bring it back to neutral. The patient just listens and does what the app says, and they just hit next, next, next. And what's happening is that information is being streamed straight to our HIPAA secured server, which allows that physical therapist to be online with them right then and there, or they can wait and schedule an appointment and talk to them about all of it after the fact if they'd like. But they see all that detailed data from which to make clinical judgments. And the MyNotify device has about 80 different exercises that are American Physical Therapy Association approved from which to choose and customize. I will add as well, these two devices are under the purview of the FDA. StepRite is a Class 2 exempt device, and MyNotify RX is a Class 1 exempt device. As I said, both of them are HIPAA secured, as is our whole system. So what are the benefits? Well, pre-surgically, there's pre-surgical revenue that I mentioned that is now available to the physical therapist or the orthopedic surgeon, depending if they own their own PTs or not. And then the new revenue stream is significant. I mean, when you look at this, we're talking about anywhere, it depends on the PCM, RTM, and RPM. It could be close to $200 per patient per month. To that physical therapist, if that's the market, then you're looking at about $100 per patient per month is the gross revenue on that. This is all new money, and therapists, if you know this or not, they got hit pretty hard just almost a year ago, where there was a fee reduction of 9%. The average physical therapist that owns his or her own business runs on a 12% margin. They just got hit with that, 8 months ago. Now, this opportunity here that you can bring to them puts money back into their pocket and really helps them with some of the issues they're facing right now with cash flow. And for you and for them, there's commissions to be earned. If that physical therapist then introduces you as a sales rep to the orthopedic surgeon, let's just say, or it could be vice versa, there's a commission that's earned by both of you, because now by getting the orthopedic involved with the physical therapist, now all of a sudden the RTM and RPM are both in play, as I'm talking about. For the patient, it's constant communication with their provider, and that's what Medicare wants. That's the whole essence of RPM and RTM, so that things can be caught before they're at an exacerbated state. Okay, keeps the patient compliant, because now they have this device that they're using, and they know that they're being watched, and they're fun, easy exercises to do, but they don't have to do it at the clinic. They don't have to drive there. They may have pain and other issues that causes them to not be able to make it. And guess what? There might be a $20 copay for some of these services, but not with RTM. There may not be. It depends on the ancillary coverage that they have. So the good thing is, like I said, it could lead to some early detection on things on that other joint or what have you that may be causing a problem in the very near future. For you, what's in it for you? That's where the rubber meets the road, right? We pay a commission to you based on the amount of patients that the providers have, whether it's an orthopedic surgeon doing RPM, RTM, or if it's the physical therapist doing RTM. But here's how it works. You earn a commission per patient per month, almost like in perpetuity, for as long as that patient is doing their therapy, which is normally 2 to 3 years. So you figure a physical therapist that might have 300 or 400 patients over the course of the year, 400 or 500 patients, you're making a commission per patient per month. And the doctors, they do the same thing when it's not a commission. They're actually paying a fee to use the device as with the PT, but the math works out beautifully and everybody wins in that scenario. It's really easy to implement this programming. A lot of your orthopedic surgeons, they've heard of RPM, but they have not been in the game. Most of your physical therapists have heard about RPM, again, could not get into the game. But now with RTM, they're put squarely into the game, and it's a real boon for them at this point in time. But you, as a trusted advisor to them, would help them with just a few things. Help them, create their account, execute the profile and the master agreement that we have. Simple stuff. Creating a StepRite account takes 5 minutes, and we train you how to do that on Zoom. We'll go over the agreement. It's very simple. It's just a fee-based agreement that the doctor or the PT would pay the fee to use this, and they're clearing 80+% margin using our devices, I might add. A 30-minute Zoom, if needed, if they need support getting into the EMR, we'll help them with that as well. Because in some cases that EMR work may be necessary, and in others, we could talk about that more on a training. And then we also look here at the consent. It's real important whether it's RPM or RTM that patient is consented properly, and we have the actual consent that Medicare provided and approved. They consent the patient. We have a Morse frailty assessment. We're really looking at that arthritic joint as the qualifier for patients to be able to utilize this technology. But there's a Morse frailty assessment that we do as well, because many of these surgeons and physical therapists are worried about these patients falling. And falling is the #1 cause of death in our seniors today. A lot of people don't realize it. Every 19 minutes, a senior dies from falling. And we can make a difference in that patient's life. And in doing so, add really meaningful revenue to that physical therapist or to that orthopedic surgeon. I promised here, the last slide, I'd show you a few dashboards. And here we are. If you take a look at top center, you'll see all the lines. That's a gait pattern, and that is exactly the gait pattern that is presented in the textbooks when surgeons and physical therapists learn how to analyze gait. They understand this. The lines just show if they're heel to toe striking, if they're moving from supination to pronation for forward propulsion. It shows it clearly. The lines on the side, everything is dated and time stamped, so they know if the patient's doing their therapy. This is our standard force distribution dashboard. Anything that's force distribution, whether they're just standing still, half squats, full squats, sit to stands, anything like that measures force, that's what it looks like. So you can see the left versus the right leg. You can see the quadrant of the foot where the most work is being done. And this graph line here, you're hoping over time, or a PT or an ortho would, that this line gets closer and closer together. So this patient here has actually done pretty good over time. As you can see, they're rather symmetrical. Again, you have all the time stamping here. Here is an example of a range of motion. In this case, it's a calf raise or calf raise. And you'll see here the pie charts, what the person can do. Anytime there's a range of motion, whether it's a knee extension, hip abduction, hip adduction, it doesn't matter. It would be this type of a graph. It would show the pie charts. It would show the degrees. And anything in red here, we did this on purpose here. If there's anything in red, that means the patient was not compliant doing their therapy for that day. And the PT would get a notification of that. So they know, hey, Johnny Ross didn't do his therapy today. Maybe I'll call to see what's going on. But it shows that because it may mean those hurt. Maybe I'm lazy. But that's between the PT and the patient to figure out, and it just helps them manage that patient more efficiently. With that, that really concludes my presentation here today.
How about how to get in contact with you? There you go.
There you go. You beat
So
me
who
to
are you
it,
looking for? Like obviously just people with PT, that would be the lowest hanging fruit.
Absolutely. Yeah, it's a great question. But yeah, if you have physical therapy contacts or orthopedic contacts, that's where you want to go. They all have heard about RTM and RPM. They don't have a basic, a full understanding of it yet, but they know it's there. They know they can add new revenue to the table doing so. You can contact me directly at the information there, or my COO, Sean Van Winkle, at the information there as well.
Well, I wrote down 5 questions, but I crossed off 4 of them because you ended up covering them during your presentation. I guess the last question I have, do you have any kind of trial or someone who wants to maybe dip their toe in the water? What's a good way to get started with new practice?
So your question is how to get started?
How to get, is there a hook to get them to give this a try? Maybe they're a little bit skeptical or they're just not quite sure how RTM works. They want to go through the process. Well, how do you normally convince somebody to get on board and enroll them?
We really don't have too many problems with that because it's such a no-brainer. I mean, it's a new revenue source that they now have access to that they didn't have access to. And the fact that they can have this performed by a physical therapy assistant, there's no out-of-pocket cost to them either. I mean, they're not paying for anything up front. This is all based on fees that after reimbursement. So if let's say, for example, the physical therapist, the surgeon had 100 patients and they generated, X number of dollars on those, on those patients, there's just a small fee that comes back for us for the use of the software. The device is paid for directly to us, through them by Medicare. Absolutely nothing out of pocket to the physical therapist. That I think would be the hook.
Excellent. Well, Johnny, I know this is a pretty exciting program. I was pretty excited to hear about it and love the technology. Anyone who is a premium member, we are adding a new affiliate page to your websites. We also have the StepRite, or the remote therapeutic monitoring, is in the new catalogs that will be coming out in about 2.5 weeks. You guys should receive those. So stay tuned for that. Johnny, thank you again for getting on.
Thank you very much for having me. I appreciate it.
Take care.